the economy and go full speed ahead like nothing has happened. We have to proceed carefully with our eyes wide open to make sure that we don't get a surge of new cases that go back to where we were back in July. Everyone has a role to play. Residents have to continue wearing face masks. That's even more important now as people are allowed indoors for businesses where there is a greater risk of transmission of the virus. And businesses have to be very vigilant about allowing their customers indoors. Some businesses and institutions will only be allowed to have a small percentage of people inside, so we need you to review the updated state guidelines, update your safe reopening plans, and monitor indoor activities to stay in compliance with the public health order. We also need to remind you that patrons should be wearing face coverings when not consuming inside a business. Anyone who is unclear on what is allowed can visit the state's website at corona19.ca.gov/safer-economy. There is also a link to that site on our County Corona website, which is listed right here on the podium before me. We previously tried to reopen businesses in June, but we unfortunately saw a rise in cases that eventually led us to begin to being placed on the state's watch list. Here is an opportunity that we have to learn our lessons from that experience and show that we can do both. We can support local businesses and do so safely by wearing a face covering, by keeping our distance, and practicing good hygiene. Let's not blow this opportunity. Let's work together to control our own destiny and show the rest of the state how it's done. While we're speaking of reopening businesses, I wanted to touch on something that I know is very important to people, and that's the status of our county libraries. The county library is working on a plan to offer in-person library services with a reduced occupancy in accordance with the new state guidelines. We want to provide access to our free Wi-Fi, high-speed internet service, public computers, and to our collections of over 1 million materials. We hope to soon have information that we can announce on the hours of operation for our libraries, so we thank you for your patience. With that, let me call up Supervisor Fletcher to give us the latest updates.
Thank you, and good afternoon. As we move into this new phase with additional reopenings, I think it is important that we do remind ourselves that in June we were in a similar position. What we're doing now is not exactly the same, but it is generally consistent with the step we took then, and I think we have to all remind ourselves that we have a higher case count and more community spread now than we had at the time we did that in June. We also have schools and colleges and universities coming back online, students returning to campus and some schools beginning to open, which increases the danger. So for us to not repeat what happened with the significant spike which required additional restrictions, it is going to take an indescribable vigilance and effort on the part of every San Diegan to utilize the face covering, to avoid large indoor settings, to wash your hands, to physically distance from one another. And those are the things that will give us a shot at continuing our positive trajectory. We are at level red, which is substantial community spread. We want to be going down and see our case counts decline to get to orange and then hopefully yellow. We definitely do not want to be moving back up where we were. We are the largest county in California to be in the red category. And I think that in part that's a testament to the reality we've done a good job in San Diego, better than most other counties, certainly most other large counties. And we want to be a model to the state. And in order to do that, we need to see our cases continue to trend downward as we move forward. And to see a downward trend with all of these additional things happening, everyone is going to have to make a conscious decision and choice to be even more cautious and more vigilant with what we're doing every single day. COVID-19 is still out there. It still presents a danger, and as big as the negative impact has been on the economy, it's even worse if we have to start and stop again, and we certainly want to avoid that moving forward. There are a few revisions. We'll be updating our public health order today to bring us in line with the new state guidance. There are a couple things that are being added into that. One is if you're dining inside an establishment, you must wear your mask at all times except when you are consuming the food or beverage. And so if you're seated at your table without food or beverage, you will need to wear your mask. If you're outdoors, you can continue to remove the mask once you're seated, as you have been doing. We're also recommending, not requiring, just recommending, strongly suggesting that indoor dining be prioritized for households. Individuals who live together can sit together. There's certainly no danger to individuals who live in the same household sharing an indoor meal. And then we will, in the public health order, be requiring businesses that are a part of the new guidance. So these are businesses who had their indoor operations closed and are now having their indoor operations reopened in some capacity. For those entities, they're going to need to ensure a guest sign in with the name and phone number of the guests who come in. So whether that's a salon or a restaurant or massage or tattoo parlor, you're going to need to keep a log or registry of your guests. That will aid and assist in any potential close contact or case investigations for any positive cases to be able to track down who might have been exposed in the event that there is a positive case or a potential outbreak. I want to talk briefly about another part of what we're doing. If you are an entity who is having your business posture changed as a result of what we are doing, there's restrictions in place, or you're having your daily operations change, you're adding indoor service, or your indoor service capacity is being changed. If there's any change to your operating procedures as a result of what's happened in the last 72 hours, then we need you to update your safe reopening plan. This is a good opportunity to take a moment and revisit the state website and look at the sector guidance for your sector, and then download the county safe reopening plan, fill it out consistent with your operations now, share that with your employees, talk to your employees about what's happening, and then post that outside. We'll go to the first slide here to give you some information. The blueprint for a safer economy is on the state website. The state website is covid19.ca.gov. And if you go there, you can look at your sector and you can get the sector guidance. If you have specific questions, we have an entire team on hand to help all business entities who have questions. You see the email address right there, COVID-19 business questions at sdcounty.ca.gov. But you take the guidance for your sector, and then let's go to the next slide here. And you go to the county website where we have the safe reopening plans, coronavirus-sd.com. You click safe reopening, and then you will fill out your reopening plan consistent with that state guidance and that sector guidance and post that. Again, it's updating if you're changing capacity or percentages. Update that, share that with your employees, talk to them about what is the plan moving forward and all of the steps you're going to take to limit the spread, and then post that so it's available for your customers to review. With that, let's jump into today's numbers. Testing numbers are down a bit. We're right at just a little bit below our 7-day goal. Some of this is lessened demand due to the reduction in cases. Some of it is a re-emphasis on our priority testing that we're seeing. We do expect, as we are supporting schools that are beginning the process of returning, and some colleges, those testing numbers will increase, but just a little bit below our 7-day goal. Percentage of positive at 3.7 and 830,000 total tests reported. Contact tracing and case investigations are doing well, as is treatment. On this slide now, you'll see today we're reporting 304 new positive cases out of 5,731 tests for today, for a 5% percentage of positive for today. And then in the purple line there, you see the rolling 14-day average of 3.7. So a few days above our rolling 14-day average. Again, one day doesn't make a trend, but we would like to see these numbers continue to trend downward, especially if we would like to go to the next category, which is orange, and continue our reopening process. Daily hospital census, are you looking at reasonably flat yesterday to today? Slight uptick in COVID-related ICUs, slight uptick in COVID-related hospitalizations, generally holding consistent for where we've been for about the past 2 weeks. Next, we'll look at total hospital census. You see our COVID number there at the bottom, our non-COVID number there at the top, 4,288. Well below the 80% threshold we have there at 4,890. Final chart is ICU utilization. You see our 96 COVID-related ICUs. Non-COVID, you see right there, bringing us to a total of 464, 66% capacity in our ICU system, which is holding remarkably steady and stable over the past month or so. That concludes my update. I'll turn it over to Dr. Wooten for a Public Health Officer's update.
Good afternoon, everyone, and thank you, Supervisor Fletcher. Welcome to today's briefing. All global, national, and state statistics are based on the data that we retrieve every day from the Johns Hopkins dashboard, and it was obtained today at noon. So the first three columns shows that information. Today's local statistics in San Diego County are from reports as of 11:59 yesterday or Sunday night. Today, there is a total of 38,604 cases, which is 304 more cases than yesterday, an increase in new cases since yesterday's report of 253 cases. The overall total number of cases includes 682 deaths. We had no new deaths reported since yesterday. The age range is unchanged, 3 months to 102 years of age. If you can go to the next slide. The age groups from 20 to 49 years of age remains at 59%, and that is 22,663 cases. This age group makes up the largest percentage of the overall number of cases. Percentages for female and males remain unchanged, 51.5% for females, 48.5% for males. We have approximately 104 individuals for which no gender information is identified. 8% of our total numbers of cases have been hospitalized. This includes 3,111 cases. Of that number, 750 have been admitted to the ICU. This number is 2% of the total number of cases and 24% of the total number of those hospitalized. Next slide. Related to hospitalization. This is the data here. So the next slide is our COVID-19 demographics related to hospitalized cases. The majority, or 2,213, or 71% of the 3,111 total hospitalizations are among individuals that are 50 years of age and older. Males represent the majority of those hospitalized at 54%. Hispanics and Latinos represent the majority of those hospitalized at 62%. In the next slide, the total number of deaths, 682, represent 1.8% of the total number of cases, and this is also the county's case fatality ratio. Of the deaths, 296 or 43 are female, 386 or 57% are male. 6,055 or 96% of all of the total deaths had underlying medical conditions, meaning 4% of this total had no underlying medical conditions. And I would like to, as always, extend our sincerest sympathies and condolences to the families and friends of those individuals that have lost their lives to COVID-19. Now I will discuss a summary of our outbreaks. Since the beginning of the pandemic, 402 total outbreaks have occurred in 3 categories: skilled nursing facilities, other congregate settings, and community settings. Of the 402 outbreaks, 282 or 70% are now closed or inactive, meaning there have been no cases in the past 14 days or longer. This leaves 120 or 30%, approximately a third of the 402 outbreaks that are active outbreaks. Of these 120 active outbreaks, 23 or 19% are in skilled nursing facilities, and we have 86 SNFs in San Diego County. In this setting, there have been 850 residents and 556 staff that have been diagnosed with laboratory-confirmed COVID-19, and this includes 158 deaths. 30 or 25% of the 120 active outbreaks are in non-skilled nursing facilities or other congregate settings. In this category, there have been 787 residents and 609 staff reported, which includes 109 deaths. And lastly, 67 or 56% of the 106 active outbreaks are in community setting locations. Community setting locations are defined, or outbreaks in this setting is defined as 3 or more laboratory-confirmed COVID-19 cases in different households with an onset in the past 14 days. This slide shows all 238 active and inactive community setting outbreaks since March 25th by month, and that's the next slide. And this accounts for 1,664 cases. Note that for the month of July, we reported the largest number of outbreaks with 93, representing 548 cases of the 238 community outbreaks. In August, there's a close second behind July, with 84 outbreaks representing 440 cases. Keep in mind, only 67 of the 238 community outbreaks are still active. In the next slide, this shows all 238 outbreaks since March by community setting. The top 3 settings of all 238 community setting outbreaks include 58 outbreaks in restaurants/bars and 14 in restaurants, for a total of 82 outbreaks. The next category is in businesses, 67 outbreaks, and then 22 outbreaks in health care settings. Now, community outbreaks is also trigger number 2 and the only abnormal trigger. If we can go to the next slide. Today, we are reporting 16 total community outbreaks for the past 7 days, from August 24th through August 30th, which represents 58 cases. Today, in the next slide, 2 new community outbreaks were added and include one in a business and one in a restaurant/bar. In the next slide, overall shown are the 16 outbreaks. Next slide. By settings, which include 9 in businesses, 2 in food processing facilities, 2 in healthcare settings, 1 in a restaurant only, 1 in a restaurant/bar, and 1 in a nail salon. Now, as of Friday, and as a reminder, the governor announced the blueprint for a safer economy, which is intended to reduce COVID-19 in the state and consists of revised criteria for loosening and tightening restrictions on activities. The blueprint replaces the county data monitoring list for determining what businesses can and cannot open. There are now only 2 metrics used for this purpose: case rate and % of testing positivity. Every county in California has been assigned to a tier based on the county's rate of new cases, which is calculated differently than the prior case rate. Previously, the case rate was calculated beginning with a 3-day lag and then the last 14 days. And with this new case rate, it is a 7-day lag and then the last 7 days prior to the lag. So that is the difference in the way those 2 are primarily calculated. Now, at a minimum, counties must maintain or remain in a tier for at least 3 weeks before moving to another tier, either up or down. And the county must meet metrics for the next tier for 2 weeks before moving to that tier. Again, up to the purple tier 1 or down to the orange tier 3, and we want to move down to the orange tier 3. Counties can only move 1 tier at a time, and the state will assess metrics weekly and report the status on Tuesdays. So the next update will be tomorrow. Now, sectors allowed to open include hair salons and barbershops and nail salons. They will be allowed to open indoors with modifications, and modifications mean utilizing face coverings and social distancing, hygiene, and not letting people in if they're sick. As a reminder, this new tiered system is effective today, August 31st. Also, reopening of schools K through 12 is not impacted for San Diego County, and today is our last day on the 14 days after being off the state's monitoring list, and tomorrow, Tuesday, September 1st, schools K through 12 can open if they choose to do so. Please, again, go to the website for the Blueprint for a Safer Economy at covid19.ca.gov. So to everyone, in order to maintain our current status or to move to a lower tier, we need your continued support. And as the health officer, I want to thank everyone for everything that has been done to date to get us to where we are. Going forward, however, we must build on this success with the continued focus to protect one another, to protect our family, our friends, and our communities and neighbors. Doing so will allow us to remain safe as we journey our way through this pandemic. So, in closing, just want to emphasize again that keeping up the momentum to stay on track and not go backwards in this new tier system to the tier, the purple tier, will require that all of us follow these best practices that are focused here on this slide. And these include washing your hands and maintaining good sanitation, keeping 6 feet apart, wearing a facial covering, avoiding crowded places, staying at home if you are sick. So only by being vigilant with these strategies will San Diego County be able to maintain our current Tier 2 status or advance to a lower risk tier. Now please welcome back to the podium Chairman Greg Cox. Thank you.
Thank you, Dr. Wooten. We'll go directly to the media questions.
Bridget Naso, NBC7.
Hello. Thank you very much. My question is, you mentioned the case numbers must be maintained for 2 weeks to move into a different tier, let's say possibly a lower tier. There was a call by small businesses today to reopen more than 25% capacity, they say, because it's just not enough to support their businesses. What do you want to say to them in light of what the criteria is in order to move down to a lower tier? And maybe more carefully define the orange tier. What are the case counts and what do the numbers have to be to get there and stay there?
Well, I'm going to have Dr. Wooten respond to that, but I think the quick answer is that the governor at this point is really deciding what the criteria is, and those are the guidelines we have to live by. But I'll let Dr. Wooten go ahead and say anything additional she wants to.
Thank you for the question, but it was a bit difficult to hear you, but Supervisor and Chairman Greg Cox is absolutely correct. We are abiding by the guidelines as given to us from the state. So again, no county can move unless they maintain their current status for at least 3 weeks. And in the last 2 of those 3 weeks, if they want to move to another tier and people want to move to a lower risk tier, your metrics have to be similar to that tier for 2 weeks before advancing. So for instance, if we want to move to the orange tier, which is tier 3, in the last 2 weeks of the 3-week period that we have to maintain our current status, we have to have the numbers, case rates, and testing positivity reflective of the orange tier, and you see them in the 3rd line there. Does that answer your question?
Yes, I mean, there is a call for businesses to be able to serve more customers. What's your response to the call for that?
Well, what we are encouraging businesses to do is to continue to do outdoor dining, to do pickup, and then the allowance at this time is 25% of their capacity. That is what the state is currently recommending. And again, we all know what the definition of insanity is, and that is doing the same thing over and over and expecting the same results. We opened up in mid-June, and we know what happened there. So this is a new approach, a gradual approach, and we hope our businesses can hang in there so that they can continue to open up as we maintain our status. So that will require those 4 strategies that we talked about at the end of my presentation. We have to wear our facial coverings unless we are eating. Social distancing, particularly if you are not household members, particularly going to the bathroom or waiting. And also sanitation and hand hygiene, and not going out in public if you are sick, and not attending or going to large gatherings. Those are the things that we know that work. Those are the strategies that got us to where we are today. We saw our numbers, our daily cases come down after after the state imposed restrictions on July 13th, and they were effective here in San Diego on July 15th. So the county to date has done well, and we must keep up the work that we've done previously and continue that throughout the end of this year. Thank you.
Okay, we'll go to the next question.
Laura Acevedo with ABC 10 News.
Yes, thank you. My question is about the 13 new cases among students at SDSU. 3 of those students lived on campus, and so my question is this considered an outbreak? And then a follow-up question, while most of the learning is virtual, how concerned is the county about the spread among the students that are doing a few in-person classes and the over 2,500 that are living on campus?
Okay, Dr. Eric McDonald's going to respond.
Yes, thank you for asking that question. As you know, the San Diego State University community is really large. There are some students who live on campus, some who don't. We're working very closely with the leadership and the individual housing units, both on and off campus, with these students. And we have opened outbreak investigations. Clearly, you know that 13 is higher than 3, and if you look at the community as a large group, that very large group at San Diego State, you could say that it meets that definition. But we're actually looking more focused about where these individuals live and where they have been, and I would say that we are still having those under investigation.
Okay, the next question.
Taryn Mento, KPBS.
Hi, Dr. Wooten, you just said, the definition of insanity is doing the same thing over and over again, expecting a different result. And you mentioned that this reopening approach is different than last time because there are tiers, but it feels like the start line is similar to what we did last time. And I'm going to specifically point to restaurants, 25% capacity. I believe that's what we did last time. Even during shutdown, we still know that outbreaks in restaurants are where that's where a lot of them are. So what is in this latest reopening plan, as of the current tier that we're on, that gives you confidence that we won't see a repeat surge like we did last time?
Okay, Dr. Wooten.
Thank you for the opportunity to clarify again. So last time when we opened up, things opened up 100%. So there was not 50. The only thing, sectors that had fraction proportional openings up were movies, 25% or 100 people, whichever was less, and churches. Those were the only 2. Everything else opened. So that is the difference between the last time and this time. And there are some entities such as bars, the state has stated that they are not open. So there are some variations, but I agree, if people do not do what we are asking them to do, we will find ourselves in the very same situation that we did in mid-July. Thank you.
And if I could just ask a follow-up, if people, specifically businesses, aren't doing what they're supposed to do, are we making any changes to ensure compliance with health orders? Because we know that was a challenge earlier.
Well, the changes that is gravely different from before is that we have a compliance program that's in place. And that has been quite successful. Restaurants is one situation where we've always had a process in place that if there are issues with that restaurant, our Department of Environmental Health goes out, conducts an assessment. So we are confident that our compliance program is working, but everyone has to work with us. We have we actually have a hotline, but we're transitioning that to a online notice where employers can let us know about their employees that might be infected. And also, because of the compliance program, that's an opportunity for individuals to report any situations such as any violations that they feel are in place. So that is definitely a difference from mid-July. Thank you.
Thank you, Dr. Wooten.
Okay, next question.
Brandon Lewis, CBS 8.
Yes, I have two questions. The first is the 10 p.m. curfew still in effect for restaurants?
Yes, it is. Was there a follow-up? Okay, next question.
Paul Sisson, the San Diego Union Tribune.
Hi, this question is for Dr. Wooten. On Friday, we talked about the idea that she could be more restrictive than the state's guidelines if she wished. At the time, she said, you know, I'm just seeing these today, give me a little time, think about this. I haven't heard of any action to be more restrictive today. I wonder if Dr. Wooten can kind of walk us through her decision-making in terms of why she decided not to be more restrictive with this reopening than the state guidelines, and also in terms of the calls that have occurred over the weekend with some asking her to be more restrictive, saying that this is moving too fast.
Okay, Dr. Wooten.
So thank you, Paul, for that question. And what we are actually will be modifying our health officer's orders, which will be effective midnight tonight. But we have made some more restrictive actions that will be in the health officer's orders, and those include, particularly when you're going to the restaurant, for individuals to wear their facial coverings at all times, with the exception of eating or drinking. Previously, if people were sitting, they could not wear their facial coverings. And also, we will be asking, again, with the restaurant sector, we will be asking them to, and actually all businesses such as our personal care businesses, restaurants, and others, to document individuals, to have an appointment log or a registration log, so that if there are outbreaks in those facilities, that information can help us more effectively investigate that process. So that's what we have done in terms of being more restrictive. If you will review the state's guidance, actually some of the recommendations are more restrictive. For instance, and we're trying to verify this, but on Friday it was stated that grocery stores would operate at 50%. We're still trying to clarify that because it is inconsistent in some locations. But if that pans out to be true, that's more restrictive. Bars closing is more restrictive than what we were before. So there are subtle changes, but we are continuing with the recommendations made by the state, along with the recommendations or actions that I've just explained. So that's where we are today, Paul. Thank you.
And another question, if I might, regarding enforcement. We've heard a fair amount over the weekend out of San Diego State with that university getting back underway. There have been a fair number of observations of a lot of students not wearing masks when they're out and about. We've seen just today the university indicate that they're going to hire private security to help them make sure that there is greater compliance. And I wonder if you feel like that's enough, if more ought to be done. And in general, with individual compliance, I wonder what else you think needs to be done. Generally, the county's compliance program, I think, has focused on businesses rather than individuals. Do you think it's time for the local law enforcement and such to get more aggressive with individual enforcement of distancing and masking requirements?
Paul, we continue to work with our local law enforcement from the various municipalities. We will be working with the schools. We have meetings not only with San Diego State, but with other of our universities and institutions of higher learning in San Diego. So we will continue to work with all of these various sectors to get our arms around what's happening. So we are aware, and we'll continue to work to try to address the issues. I don't have any specific plans for you at this point in time, but we will continue to work our compliance program and work with the institutions I've mentioned. Thank you.
Dr. Wooten, this text question is from Brandon Lewis from CBS 8. He asks if you can please walk us through the numbers used to calculate the 5.8 case rate.
Okay, so we actually, just as we did with the last case rate, we have that worked out and we can send it to you. But again, it is 7-day lag, then the next 7 days, and you total those 7 days and you divide it by the population, and we're using the Department of Finance. That's what the state uses, and you multiply that by 100,000 population. So it's very similar, the steps, to what we've shared with you before. Before it was a 3-day lag, and then 14 days, and you total 14 days, and you divide that by the population. So that's why before the case rate was anywhere from 2 to 3 digits, and this is 1 digit, as is, if you can go back to the slide. So that's the way the case rate is calculated. And it probably also is on the state's website, but we will be placing the calculations on our website as well. Thank you.
Thank you, Dr. Wooten.
Okay, this last texted question we have deals with questions of the mathematics and possibility of false positives, and Dr. Eric McDonald's going to respond.
This text question is from Mike McKinnon with KUSI. He writes, KUSI recently interviewed a data expert that found it is mathematically impossible to get to the lowest setting on Newsom's new guidelines. He said testing 1,650 people yields 33 false positives. Is the lowest setting impossible to achieve?
Well, I do need to check the math, so and I'm not that good off the top of my head, and so maybe you can connect me directly with that data expert. But I will say that the numbers that we use to report are confirmed PCR cases, and the false positivity rate with using PCR tests is exceedingly low. It is true that some of the other tests that are used, such as antigen testing and other tests, sometimes have higher false positive rates, and that is a problem when the overall incidence or number of actual cases in the community begins to go down. But I will look carefully at that, and again, I think that the false positivity rate for PCR tests shouldn't make that a problem, but we will circle back with you and talk to the state about that.
Well, that does it for today. We will be back here again on Wednesday at 2:30 for another media briefing. Again, we've made some tremendous progress over the last 6 weeks or so, but we know with the reopening of more businesses and lightening up, if you will, of some of the restrictions we've had to deal with, is an opportunity that we have. And it's important that we don't blow that opportunity by kind of reverting back to some of our old ways. And so again, we ask everybody's cooperation to wear those facial coverings, to keep that social distancing, and to stay safe while you're out there. That concludes it for today. We'll see you on Wednesday.